I'm Peter Block for CVN, and this is a CVN special report from EuroPCR in Barcelona, Spain. With me from Barcelona directly is Dr. Vasilis Babalieros, who is one of my colleagues from Emory, who is in Barcelona. Vasilis, we're talking about the late-breaking clinical trials today, and I understand that there are 3 major trials that came out today, 1 a post-conditioning trial and 2 left main stenting trials. So let's start with the post-conditioning, Vasilis.
Great, Peter. This was the first day of late-breaking trials. The post-conditioning study was a study that looked at a method which patients that had their first ST elevation MI that were taken to the cath lab within 12 hours and had TIMI 0 or 1 flow were randomized to either conventional therapy of stenting or a post-conditioning strategy which consisted of 4 30-second inflations with deflations in between.
Vasilis, we have done a CVN piece on this in the past at ACC, and it sounded pretty much like black magic to me, but tell me what the outcomes are.
They followed the patients up at 3 months with an MRI, and also clinically, the results were fairly interesting. It looks like the area at risk after the MI and the infarct size was 15 to 20% reduced by post-conditioning strategy. In addition to that, when you follow the patients clinically, they were able to reduce the number of patients that had class 3 or 4 New York Heart Association heart failure by 50%.
What about the number of patients, Vasilis? Are we going to be able to find some more patients for this trial ultimately? And where do you think it's going?
Peter, this is only about 100 patients that they had for MRI and clinical follow-up. Certainly it's a good start, but we're going to need more patients to prove this concept.
Very good. Okay, let's move on then to the 2 late-breaking clinical trials concerning the left main coronary stenting. We have a longer-term follow-up of Syntax and a new trial with sirolimus stents. So let's start with the Syntax trial. Vasilis, what is that?
Well, the Le Mans study was a 15-month follow-up from Syntax on patients that had left main disease and underwent either CABG or stenting with the Taxus drug-eluting stent. They had 271 patients in the trial, of which half received bypass and half received stenting. There were very few that had isolated left main, about 15%. The majority had left main plus 2 vessel or left main plus 3 vessel disease.
Tell me what the outcomes were from this Syntax study then.
Well, in the Syntax study, follow-up on the bypass patient was a little bit surprising. 16% of patients that underwent bypass for left main disease had either an occluded graft or a graft with more than 50% stenosis in it. There was no death in the 15-month follow-up, and the MACE rate was approximately 9%. The Taxus group, however, that got the stenting, had a higher MACE, 13%, death was 2%, and revascularization was 9%, which was previously 0 in the bypass group. The distinction here, Peter, was that if stenting involved the distal left main, that only 90% were free of restenosis at follow-up. If stenting involved only the ostium or the body of the left main, 98% were free of restenosis and free of a lot of these problems we described.
So very much like the initial results of this study. So let's move quickly then to the second study, the sirolimus-eluting stent. Remember that Syntax involved the Taxus stent. So what about this second study, Vasilis?
Peter, this was a group of 160 patients, half of which received the Cypher stent to the left main, and the other half that underwent bypass surgery. They all took Plavix for about a year, and there were follow-up endpoints at 1 year and as far out as 5 years. The results here in patients that, again, had probably a preponderance of distal left main disease were as follows. Bypass patients, 2% had strokes. 2% needed rethoracotomy after surgery, and 2% had major bleeding that required the rethoracotomies. So there was more death in the CABG group. There was more acute myocardial infarction in the CABG group, but revascularization was double in the stent group. And when you follow these patients out to approximately 25 months, it looks like the MACE rate where PCI and cabbage were equivalent.
Well, fascinating initial outcomes, and it sounds as though we're getting repetitive results from both of these trials from what the earlier syntax results were. All of that is good because it means we may be getting closer to the truth here. Vasilis, give me a quick take-home message about the left main studies that we've just discussed.
Well, the feeling here is these two left main studies show that stenting is not a non-inferior treatment. So, though it can be done, and probably for the ostium and the body of the left main is okay, it needs to be individualized per patient and is not yet ready for prime time.
Sounds like a perfect take-home message. Thank you, Vasilis. We'll be back with you tomorrow for more late-breaking trials, so come back to CVN for further late-breaking trials from EuroPCR in Barcelona. I'm Peter Block, signing off for CVN for today.